Eastern Cape says it's taking steps to address the overwhelmed health infrastructure in the province. Patients are being moved from the Dora Nginza Hospital, which is overwhelmed with a dire shortage of critical care capacity. Let's discuss this further. We're joined by Mvusiwekhaya, Sicwetsha, who is the Premier's spokesperson. Good evening, Mvusiwekhaya. It's a pleasure to have you with us tonight. By all indications, the health system in the Eastern Cape has collapsed, and it now seems it's taken intervention from the National Department and the Minister in particular in order to get things back on track there. How did this happen?
We are experiencing challenges, but we have not collapsed. Our system has not collapsed. What we are seeing are challenges stemming from bad management choices that have been made at hospital level and at the provincial department level. But you still have successes in some of the hospitals where the rate of people recovering from the virus has been assisted by healthcare workers in these hospitals. Not all is lost at the provincial department and in some hospitals also. But what you are seeing, for instance, the assessment that was done because the Premier wanted to get to the root cause of the problems. And he approached the minister because the minister has a constitutional responsibility to assist the province. And it's not because we are unable to do anything or because we have failed. He needed an independent assessment of the situation. And he has taken a decision now to correct the issues that were identified by that independent assessment from the team, and has put together a multidisciplinary team to address systematic issues, administrative problems, and also put in place financial management systems that are in the department.
Mvusiwekhaya, you've described part of the problem as being officials at the individual hospitals and officials at provincial department level who are making bad decisions. Who are these officials and why are they still in their jobs?
The system of government allows a process where when there are challenges, you identify those challenges, you support that department and those people to be able to do their work effectively. So what we have been doing, we have effected Section 18 of the PFMA in that department to support the department to address all these problems. And until we get to a point where we see wrongdoing, no one is going to lose their jobs because government has a responsibility to provide support to all those workers in that department. You only remove people where there are gross incidents of misconduct, corruption, and all those type of things. We are supporting the department because it is our responsibility to support the department so that the department is
Are you saying that some of the incidents that we have seen come out of Eastern Cape hospitals, including part of what has made local headlines and international headlines, are you saying that that doesn't amount to gross negligence?
Let me give you an example about the situation at Dora Nginza, for instance, and Livingston. The problems that we've picked up there is that the infrastructure of that facility is not up to standard. The decisions that were not made to procure were hampering the work that is being done. And the report that the Premier has is being implemented to fix those problems. And I will say to you, if as we continue, we identify deliberate negligence, and actually negligence, let me not define it as deliberate because negligence is negligence. When we identify those instances, the team is going to be able to deal with those situations. What we want to do now is to capacitate the health system to provide support to people that need health care in all the hospitals of the province. We could not, for instance, provide...
Mvusiwekhaya, part of the reason why the hospitals are even in the state that they are in is because they've been neglected. So who then takes accountability for the state that those hospitals are in? Whose shoulder? Who bears, who bears the responsibility for the fact that these institutions are in that state? Because it can't be a case of we have officials who've made bad decisions, but we're helping the problem along now that we're in a crisis. The question is, how did the system even allow these facilities to get into that state in the first place?
We are not helping the problem. We are resolving the problem. the decisions that are made by CEOs of the hospitals have not yielded the results that we want to do. What the Premier has asked the team to consider as they implement the recommendations of the report is to look at the capacity of the CEOs of these hospitals. How do they contribute to the problems that we are seeing? Because before the COVID-19 outbreak, for instance, they were blaming all these problems, the red tape in the system of the department, when you procure, when you do this and that. So we've now removed all that red tape and deployed senior managers of the department into all these major hospitals and districts, so that all the issues that were raised, that were delaying this work, are resolved, and the department is able to perform according to what it is required to do so. So anyone who makes it impossible for this team to work, we are going to provide...
But of course, they can't make it impossible, because Dr. Sibongile Zungu is in the Eastern Cape on the instruction of the minister. So the people who you're talking about don't have a choice but to listen to the minister's advisor, who we understand is now going to be running the entire project of managing the Eastern Cape's health system. And let's note that opposition parties are calling for the department to be placed under administration.
I think together with the opposition parties, you get this wrong. The Premier has requested the minister to avail a person to provide support. Dr. Zungu is not running the Department of Health. She is running the PMU that the Premier has set up to address with speed all the issues that the report that was put together by the team she was leading has identified. So she's doing that work, working with the Department of Health, providing support to that department. So it's not like she's taking over. We don't think there is a need for a Section 100 in the Department of Health. We are working together with the minister and the national department as we work through the IGL framework of government to ensure that the work that that department has to do, it continues to be done. Where there are problems, let's correct those. Let's make sure that there are consequences for any failures that we see in the system.
Mvusiwekhaya, I'm certainly not hearing about any consequences that are going to be there to ensure that people who've made some of the bad decisions are actually held accountable. But that's where we leave it for tonight. Mvusiwekhaya, Sicwetsha, he is with the Eastern Cape Department, and he speaks on behalf of the provincial government there.